Good morning. Happy Friday, everyone. This is Dr. Jen. Hopefully, you can hear me well. The topic today is joy as medicine. It's one of my favorite topics, and it really is a key principle to how I practice lifestyle medicine and medicine in general. So, I think that part of how I got here, which I'll explain, but often we think that when we're making a lifestyle change in particular, that we think it has to be hard, that if we don't have discipline, then we're doing or willpower, then we're doing it wrong, and then it's all about discipline. And I often find that when we push harder, when we, lean into that restriction, number one, it sets up this all or nothing pathway and, you feel like if I can't do it right, well, then why even bother? And then the other thing is that sometimes it's more stressful, which stress we know is a factor in a lot of chronic diseases and in our health in general. And so that constant feeling like we have to calculate every detail, worry about, every calorie, macro, pound, it adds this layer of stress to our life that really isn't sustainable and isn't really good. And we as humans, we have, five senses for a reason. We have, you know, um, a brain that experiences love and connection for a reason. And I'll go into a little bit about the physiology behind that. But we can't separate the brain from our bodies as hard as we try to do sometimes in Western medicine. And so that is something. So how did I get here? I will say that as I'm pediatric intensive care physician trained practiced pediatric critical care for close to 20 years. And obviously, technology and precision is critical in critical illness, right? Especially in acutely ill when we're managing a child that has gone through a trauma or has infection or maybe can't eat on their own. All of these things require precision medicine. But you know what? What I found is that once we got out of that critical stage, that really acute stage when we had to measure every detail and count everything, that a lot of the things that moved the needle towards healing were these soft sort of things, the lifestyle part of it. And even past the lifestyle part of it, it was like when you talk about children, it's the connection, the whether it's their family, their grandparents, their mother, that sometimes is the voice, their mother's voice, the family's voice, music, touch, all of these things had amazing healing properties. You would see a child's heart rate go down just when they heard a familiar voice. Or I mean, I'm talking about children, but really it's in adults too. You notice that with proper nutrition and maybe something that they enjoy, it brings joy, so that actually makes them move forward as far as, healing in that way. So there's so much in this part of medicine, lifestyle medicine, which is the 6 pillars, which if you didn't see last week's video, I talked about, it's, nutrition, plant predominant nutrition, movement, sleep, stress management and mindfulness, human connection, and avoidance of toxins and risky substances. And these 6 pillars are really the baseline of medicine. When you think about what it is, when you talk about actual treating or healing disease, I like to talk about beyond managing. These are the things that make the difference. But joy, which I like to talk about as my 7th pillar, is really the thing that makes it make sense. It's really the thing that helps it stick. It makes it sustainable, and it makes it makes our life more purposeful. So I found that I have a joyful metabolic reset, which is a program focused on helping women reverse insulin resistance and type 2 diabetes. And one of the things when I talk to people, about reversing diabetes, and we talk about, things that help, that really move the needle, often the subject comes up that they feel like they're doing everything wrong, that they have not been able to stick to, whatever diet or program that they've done in the past, that they feel unheard. And these things really take a toll because number one, it keeps you from making the moves that help your health, improve your health. But it also makes you feel like you are, failing somehow. And that is not good. So when I lean into the joy factor, it makes it more accessible, more doable, but also it helps literally change physiology. It helps people in the past that may have had difficulty controlling diabetes be able to control diabetes. When you talk about things like asthma, pretty much any illness, when you talk about asthma or hypertension or heart disease, stress and the opposite of stress can have a huge difference, make a huge difference. So I will so the let's talk about the biology, right? When we talk about stress, it is not just that it emotionally feels bad. It physiologically changes your body. It elevates your cortisol. It increases inflammation. It can increase insulin resistance. It can make people with asthma have more inflammation and have more asthma attacks. It can elevate your blood pressure. So chronic stress really does have an effect. Um, the other things that are keeping us stuck are ultra processed foods. So that is another way that ultimately steals our joy because they're engineered, to stimulate that dopamine reward system. So it gives you a false sense of joy or enjoyment for that short period of time. So you might get that dopamine spike, that feeling, but then it quickly goes away and you want more. And so these, you know, um, significant stressors on our body kind of steal that natural reward system. So ultra processed foods, we are constantly connected to technology. So when you look at our phones, our computers, our emails, we're constantly connected and we're having less connection with nature and the world around us. And when you think about it, we're animals. We're meant to respond to the cycles of nature. And the farther we get away from that, the more we have more higher anxiety, we have higher stress, we have more burnout. It affects our sleep. It decreases, blunts our response and our enjoyment of just basic things, and that makes us want more of those artificial stimulants. Another thing in modern life that is common is isolation. As we've moved farther away from our natural systems of community support and families, and more people are isolated. And that connection is really important again because we are social beings, and so that again can increase inflammation. It increases stress. Poor sleep, which is compounded by all of these things that I mentioned before, worsens our metabolic health. And inflammation in general, which is a result of all of these other things, as well as what we eat and other things in modern society, can worsen chronic disease or even cause chronic disease. So when we're trying to make a sustainable lifestyle change, these factors make it even harder. So maybe you have a chronic disease or a family history of chronic disease and you're trying to avoid it. But in modern life, we're surrounded by all of these things that I mentioned before, the technology, the ultra processed foods, the isolation, and these things are working against us. And when I think about it, you look at those things that are already really highly stressful, and you add on top of it a rigid program or, more technology or medications. And it's like putting a band aid on a dam, right? On a waterfall. And so if we don't address these underlying things that we're faced with every day, then we really aren't getting to the underlying cause of a lot of what we're dealing with in modern medicine. So I looked at when I mentioned that I noticed the connection with in children in the ICU, and I also noticed a connection with women working with them in metabolic health. But one of the ways I got to this philosophy around care, around joyful medicine, is looking at the power of lifestyle medicine, those pillars that I mentioned before, but then also looking at the areas around the world where this happens naturally, where their environments support healthy lifestyle. You look at the blue zones, which are often talked about as the well-known areas around the world, but there are many other areas around the world that are built on, tight-knit communities that they are eating foods that are flavorful and tasty and whole food based. They are moving naturally throughout their lives, but really and they have that purpose, which is based on, family and connection and just that closeness. And that, in those areas, they're not forcing it, right? They are naturally in an environment that supports it, but they are joyfully living life. They're not counting everything, worrying about how many minutes of exercise or how many calories they're consuming or how many macros they're consuming. They're living their life. And when you think about lifestyle, those factors that I mentioned, they are life factors. And in order to make those life factors livable, they have to work in our daily life. And so when you meld lifestyle with the principles of the blue zones and making it livable, that it makes it sustainable and it makes it magic. It gives you not only the tools that you have, like to reintroduce, these seemingly basic principles back into life, but it gives you the joy factor. When you couple in the joy factor, it makes it more doable for the long term. So one of the things that I like to talk about is the importance of finding joy in the daily lifestyle factors, daily lifestyle change. So we think that um, when you think about living, you're not just going back to this rigidity and calculation that we're so used to in Western medicine. When you look at your life and you think about going out to a restaurant, I often hear, clients that have done this traditional method of worrying about how many carbs and things like that. Now, granted, there are specific situations where you need to worry about, you have to count your carbs, if you have to dose insulin and things like that. That's really important to know specifically an idea of what it is that you're eating. But generally, when you're eating and you're going to a restaurant, you should be enjoying it. And so I find that this rigidity bumps up against real life. And when it bumps up against real life, it sets up this cycle of judgment from the provider and guilt and shame for the patient or client. And finding a way to reach your goals without rigidity is really important. So how can we create patterns in our life that support our wellness goals, um, but make it, enjoyable and livable? So that is the baseline of my practice, is helping people, find meld life with these lifestyle principles that we know are life changing. And I'll talk a little bit about how powerful those things are. So let's just talk about how joy fits into this pattern. So when we can find joy in the little things, and I think that finding joy is within us. It's just kind of a reminder to tap into it, because again, all of these modern things have us looking outside of ourselves for joy. But when joy is something that we possess, but we have to remind ourselves, and that's really important, because again, everything that modern life, all of these conveniences that we have built, actually tend to steal our joy. They tend to take it away, to make us forget that this exists. So the way that I like to look at it is awe. If we approach life with the curiosity of a toddler, do you know how powerful that is? And that is something that we miss, we forget. As we become adults, we have so much other stuff going on. We're worrying about everything that's going on. We have many demands on our life. So when we bring it down to the simplest thing, finding enjoyment in the tiniest thing, like my cup of coffee, I always talk about this. This is one of the things that the way I like to start the day, I love to start the day with a run outside, because that reset of being outside. But one of the things I do before I start my day is I make my cup of coffee. And when I do that, I enjoy the whole ritual of it. So I put my phone away and I do the whole thing. I grind the coffee beans. I enjoy the aroma of the coffee beans. I, pour the water, measure the thing, and then I let it brew. And then I love whatever mug it is that I'm using. I personally love this little mug that I have from the French Open. So I have several mugs that I love, and that's all part of the experience. And so these tiny, seemingly insignificant things bring joy. It just reminds me of how amazing these tiny little things can be. And when we lean into these tiny little bits of awe, I like to call them joy snacks. What they do is they reset our nervous system, right? They lower our stress, they stimulate our vagus nerve, which has a positive physiologic effect, which improves our heart rate variability, slows our digestion, calms our mind. It lowers our inflammatory markers. It can reduce anxiety and reduce that overthinking that we do of rumination. It can regulate our dopamine. So when we reset our dopamine to respond to the small things, it helps um, bring awe to the day-to-day life. And this is one of the things I say, for example, when I'm working with somebody on creating a better diet or a more nutrient dense diet. Part of why that's hard is because, as I mentioned before, those ultra processed foods that we're constantly exposed to, those hyper palatable foods, they blunt the natural enjoyment you get from the flavors that occur in nature. And so when we start to lean back into these basic enjoyment, these little bits of awe, these little bits of joy sacks, we start to remind ourselves to find joy in all of these basic things that really move the needle when it comes to our health. So we can enjoy the flavor of um, fruits and vegetables, when we can find enjoyment in looking at a tiny thing in nature. Like right now, I have the two birds outside my window. When we can focus on these tiny little things, again, it resets our nervous system. It lowers our cortisol. It allows us to be open to enjoying being more satisfied by foods that are more whole and unprocessed. It allows us to find enjoyment in maybe a 10-minute walk. And physiologically, what that does is improves our insulin resistance. It lowers our inflammation. It can lower our blood pressure. And these all are things that can transmit into long-term health and longevity. So I think that this is one of the most important factors in my medical practice, and I love to help people recapture this. So other things, the natural reward system are endorphins, right? We can stimulate our endorphins just by, a short walk or finding joy in these tiny things. The joy of connection, a simple phone call and connecting with a friend can stimulate oxytocin, which is another happy hormone throughout our body. When we these all of these factors improve our sleep, they improve our digestion, they can improve our gut health, again, lower blood pressure, lower inflammation. And so really these are things that make the biggest difference. So hopefully I gave you some idea of why I think joy is medicine today, and maybe a few tips on how you can incorporate joy in your routine. So one of the things I mentioned is finding awe in the small things. One of the best ways I find is taking that moment, like finding, a time during the day where you're away from your cell phone. I find it's best to bookend my day uh, before bed, at least an hour or two, to turn off the cell phone, turn off the technology, and reconnect with yourself. And also in the morning, to not start with that dopamine hit from the phone. Maybe start with a short walk or a morning cup of coffee or just a few minutes of journaling. That's a great way to regulate yourself and start and end the day on a great note. And I think that's a great start to it. The other thing I love talking about is finding joy in the small things over the course of the day. So I mentioned my cup of coffee, but maybe it's savoring a meal. Maybe it's having a meal without, you know, distraction. We like our dinner nighttime meals at the table with the family, but that little bit of joy, even as rushed as we often are, having those few minutes unplugged, just enjoying each other's conversation is really important. So where can you find joy in your day? And one other last tip I like to say is I always recommend is, maybe considering journaling before bedtime. You don't have to journal. Sometimes before going to bed, just take a moment and think of the best thing that happened over the course of the day. When you do that, it regulates it's your, going through all of the things during your day that were good, so it makes you select for good things, and that bathes your brain in happy hormones before you go to sleep, and that can actually improve the quality of your sleep if that's something that you're having difficulty with, but in general, it's always good. It lowers your cortisol, lowers your stress, and sends you to bed on a good note. Um, so my, as I mentioned, I practice lifestyle medicine, which is using those 6 pillars for things like type 2 diabetes, diabetes in general, heart disease, asthma, and metabolic health in general. And I help people create joyful routines that make it sustainable and that they're actually able to reverse diabetes, decrease medication needs, lose weight without counting calories, and just feel better in their body and their routines. And so, if you live in New York and Vermont, I do lifestyle medicine consults. If you, I don't do primary care, but I do lifestyle medicine consults. So working toward helping people reverse those chronic conditions or manage them better. I also have a joyful metabolic reset program that's specifically geared for women in middle age. That often is a time when we start to have a change in our metabolism that results in difficult weight loss. And so creating those healthy habits as a group and creating sustainable change have had people be able to avoid medication if they have diabetes or get off medication if they have diabetes already. So those are my offerings. Always open for free discovery calls, and so you can click the link below and schedule the visit. So thank you for watching. Join me next Friday. I think I'm going to talk about creating movement or how movement supports our health. Thanks for watching.